Hello, welcome back to my video. So today we are going to watch together uh, what my daily routine looks like in a time lapse. So this is a time lapse recording, and I hope you can learn a thing or two and integrate it into your daily practice. Okay, let's watch together. Of course, this video is quite long, so feel free to skip around. I will only give necessary commentaries as I deem necessary, as not to make it too boring. Okay, for the first part, as you can see, we are using walkie-talkie for communication, so that we can streamline our communication. Previously, we have a runner to actually communicate from the room to the front desk, so which is very cumbersome and inefficient. So after some time, we figure out we use walkie-talkie to actually streamline the communication. Is initially we have some friction, but eventually it becomes part of the routine. And number two, if you watch closely, we also my at least on my end, I try to practice doing case note and completing whatever necessary in terms of the written notes for the patient, even before the next patient comes in. So means after we have done the treatment, then I will sit down, take a breather, and continue whatever necessary case note and case documentation that is needed. At the same time, since we are doing that, the assistant and the runner can actually reset the room, disinfect whatever it is necessary before we call up the second patient. So the advantage of doing this is actually when we are trying to keep our documentation to be done at the end of the day, I find it is very difficult for me to actually remember everything, every details, and I tend to miss up, and it becomes a stress point. So, in my experience, might as well we settle everything before the next patient comes in. Yeah. Okay. I hope you can appreciate my posture and how I try to maintain as much as possible in the safe range. Okay, so as you can see, after finishing up the treatment, we recapped and explained what we have done today, and straight away I use the whatever time that we have to do some case note completion. At the same time, the staff reset the room, so we don't have any downtime. On average, I will try to keep our orthodontic review time around 6 to 9 minutes on average, and we actually book patient appointment around 50 minutes, so we have plus minus time to actually communicate with patient to settle the case note. So most of the time we manage to cater within that 15-minute slot. Sometimes we go beyond, so that's why we have pro and cons there lah. So we try to fit everything within 15 minutes. Sometimes we go beyond that, but it's okay. We do not necessarily put 15 minutes for each visit. We have 15 minutes, 30 minutes, 50 minutes, 50 minutes, 30 minutes, something like that in that interval. So whenever we go beyond certain times, we can regain back the momentum in the next session, in the next appointment. Okay, it just so happened while recording this time lapse, my battery just is completely drained. So that's why I'm using the overhead chair light to actually help me to gain visualization, so that I can actually manage the treatment throughout my appointment. So of course, the best would be to use my overhead light, but just so happen during this session the battery just completely drained. So okay, it's okay, we use whatever we can. So the most important part is to actually position the overhead light as close as possible to the coaxial position, so that we can actually maximize the visual clarity while minimizing the shadow. So I know it's not ideal, but that's okay. So as you can see, it means that even if you cannot invest loop and dedicated light at the same time, you can actually use the overhead light, provided you actually position the light as close as possible to your line of vision, line of sight, as to get the benefit of coaxial lighting. All right, here in this patient, what I'm trying to show is actually sometimes when patient are not adjusting their hairband, so the visual mastery or the visual access will be slightly challenging. So sometimes I need to hip hinge. As you can see, I hip hinge a lot to settle this orthodontic review for this patient. Yeah, partly because as you can see, as you can appreciate, patient is not removing her hairband, and sometimes if it's too thick, it will cause some visual mastery issue lah, visual access issue. So be you need to understand this lah. These are the challenges that we face. That is partly why the best would be to actually ask patient to at least release the hairband so that we can actually get more optimal visual control and visual mastery to allow us to actually maintain proper posture while minimizing hip hinge. Alright, so now we are going to see from another view, from the frontal view. So this is also a time lapse of my daily routine. I'm not sure if you notice, but the blue color on the floor is actually the defect on the floor. It's been broken down for the last 2 months before I even started this recording. So this is one of the friction in terms of my ergonomic, causing me some issues when I try to move around to actually using hierarchy of movement to actually get optimal visual access. So these are the things that you need to understand. All this friction will eventually cause some issue to your ergonomic. So it just so happen in the practice I'm working, we have some issue trying to get the contractor to come and see and repair the floor, and it took quite some time. Eventually, it got settled, but yeah, it's causing friction lah in our daily routine lah, in my daily routine. From this angle, you can actually appreciate that at any moment, one assistant would be assisting the doctor, and one runner would be running around and assisting the assistant in between two rooms. So the ratio would be one assistant and per room and zero point 0.5 runner per room. So one runner is shared between two rooms, sometimes three. It depends on the scheduling. But we try to manage within two rooms, meaning one runner to settle two rooms, so that we do not want the runner to be overload and burn out so fast. So from this angle also, we can actually appreciate that I try to maintain within 11 to 12 o'clock position as best as I can, because that would be the most optimal posture. Sometimes I lean towards the 1 o'clock position to settle quadrant 3 and quadrant 2 uh, placement. So as you can see, without any time wasting, after patient came out, I settled whatever the communication, case note, and at the same time, the runner and the assistant reset the room. Alright, we are nearing the end of the video. So feel free to watch and learn, and perhaps you can see tips or two that you can actually benefit. And I hope while you are training your eye, you can actually also observe the mistakes, the deviation that I've done, and perhaps you can use it as a pointer to you to improve yourself in terms of your ergonomic and your workflow. So that's all for today's video. I hope it can be of benefit. You can learn a thing or two, inspired a thing or two, so that you improve your dental ergonomic. So that's all for me. Until next time.